Hello everyone, welcome to MEDVERSE, and today we are going to start forensic medicine rapid revision 1. Okay, so we'll start with the most important parts of forensic medicine. It will not be exhaustive, it will be exhaustive one, but the content will be not covering all of the topics but touching some of the topics, and in the second part of rapid revision we'll cover the rest of the topics, right? Okay, so we'll start with medical ethics. Ethics in Greek means habit, action, or character. Okay, so it's a set of moral principles which guides in dealing with each other, with patients, and with the state. So, doctor relationship, doctor patient, and the doctor and the state. Okay, so this a set of moral principles governing these relations is called moral ethics. Okay, or medical ethics. So, starting with the set of moral principles, we have A, B, C, D, and E. Okay, some write A, B, C, D, J, or E, whatever you can. Autonomy. Autonomy means patient right to choose treatment. The patient has whole right to what interventions and treatment he or she is subjected to. Okay, B is beneficence, that is a doctor must promote the good and it must be for the patient's benefit, right? And C is confidentiality, the patient details are kept confidential. And A, B, C, D. D is do no harm, that is non maleficence. Okay, a doctor is whatever he or she is doing must be in good faith. And E is just equity or justice, so patients have to be treated equally and fairly. It's like the no discrimination based on the caste or creed or something like that. Okay, and these principles must be adhered to. We have a state medical council. Okay, we write SMC. So what are the functions? First is registration. It maintains a register which enrolls the new members. Okay, it enrolls the new members, just pass out from medical colleges, then internship, then after you register, and you have a registration number uniquely for doctors. Erasure of name in case of death of doctor, untraceability, disciplinary action which is called penal erasure, right? If a doctor commits some infamous conduct, what is infamous conduct I will tell you. Infamous conduct or any conduct which is harmful to the patient, and this or negligent cases, the medical register, the state medical council can erase the name of a doctor. Okay, can erase the name of a doctor, which is called penal erasure. Then disciplinary action against RMP. So there is a complainant or convicted or suo motu case. Okay, so president will form the subcommittee, or president of the SMC forms a subcommittee which has doctors of good repute and odd number of doctors. Odd number. Okay, odd number, why? Because if you will be doing a voting and even number is there, then 50 will be there, but in odd number one vote will be extra in all cases, right? So the subcommittee can acquit a doctor, that is the drop the charges on the doctor. So let's say doctor A is now free. Okay, either he has him free the doctor or give a warning for repeat offenses, give a warning, or can remove the name of the doctor, which is called temporary or permanent. In case of serious professional misconduct, professional death sentence means ending a career of the doctor, that is permanent erasure of name. Okay, the name cannot be put again. And after this the doctor can appeal in the EMRB. Okay, EMRB is Ethics and Medical Registration Board. Okay, this is EMRB under NMC. It was established in 25th September 2020. Okay, recently. And a doctor can appeal here, and this board will be regulating the professional and ethical conducts and maintains a national register of RMPs. Okay, so it's a national level thing. So state medical council, if it gives a penal erasure or a professional death sentence, okay, then the doctor can appeal in the EMRB. EMRB is under NMC guidelines. Okay, so National Medical Commission undergraduate. So National Medical Commission, NMC, National Medical Commission has 4 divisions. One is the UG Medical Board, UGMB. as the PG Medical Board, PG Medical Examination Board, Medical Assessment and Rating Board MARB, and EMRB. So UGMB, PGEMB, MARB and EMRB are the four pillars of National Medical Commission. Undergraduate Medical Board, which are the education, courses, examinations and norms for recognizing medical qualifications, okay, for MBBS. This is for MBBS, okay. And Postgraduate Medical Board for standards of post graduation and super speciality, that is for MD and DM degrees, okay. The regulations are made by the Postgraduate Medical Education Board. Medical Assessment and Rating Board is basically giving the permission to open a medical college, or maintaining permission opening and maintaining a medical college. This Medical Assessment and Rating Board. And EMRB, I talked to you about, that regulates professional and ethical conduct, okay. It also has a EMRB register which contains all the names of doctors of India, right. All the licensed medical practitioner list is there for EMRB. After EMRB, if C isn't satisfied with the decision of EMRB, it can directly approach the NMC, okay. So what are the schedules of NMC, which is not much important? First, list of degrees awarded by Indian universities. Degrees awarded by Indian universities is under first schedule. Second schedule, list of degrees awarded by foreign universities, okay. Third schedule, part 1 and part 2, medical qualifications by Indian university not included in schedule 1, and part 2 is medical qualification by foreign university not included in schedule 2, okay. So this is not much important, just to know. Okay, this is important. Professional misconduct or infamous conduct. Professional misconduct or infamous conduct, which is an unethical act. So starting with, what are the professional misconducts? You can remember by A, B, C, D, E, F and G, okay. From A, addiction, okay. Doctor cannot work in place in in addicted environment, or if doctor is having under the influence of alcohol, he or she isn't fit for doing any surgery or medical procedures, right. Association means with unqualified person. If he appoints some let's say barber for stitching the wounds or for helping him in surgery, okay. So this is an unqualified person. If he or she is employing someone like that, if a compounder is helping the doctor to suture the wounds, okay, like this is illegal, or you can say unethical. Abortions without MTP, which defy the MTP Act. Abortions which defy the MTP Act. Advertisements, inappropriate advertisements are illegal. In advertisements, just remember that a doctor can advertise, okay. He or she is given freedom. Medical relevant qualifications, which he or she is writing must be relevant, okay. Irrelevant qualifications like fellowship courses and all shouldn't be written. A doctor can only advertise only when he or she is opening a business, opening a clinic, for example, and while sifting, that too, opening a clinic 2 times he can advertise, and sifting 2 times he can advertise, okay. These are the qualifications for advertisements. Adultery, improper conduct with patient. B is bribery. He or she is accepting bribe, then it's a professional misconduct. Conviction, commission and covering, okay. A commission of a crime or a covering of a crime, employing or assisting an unqualified person. D is dichotomy, that is fee splitting, disclosure of professional secrets, okay. D is a dichotomy and disclosure of professional secrets. Dichotomy means fee splitting, means taking commission from path labs, from ultrasound centers and all. And disclosure of professional secrets also. E is endorsement of any medical company or brand, okay. If he or she is endorsing a medical company or brand, then it is also professional misconduct. F is false certificate, false fitness certificates and all. G is gift from pharmaceutical companies. This is also not this is prevalent and widely practiced, but this is not this is a professional misconduct. Guaranteeing cure to his or her patient, okay. He can't guarantee cure, okay. Entire list is called as warning notice. It's a long list. These are some of the important points. This entire list is called warning notice. Warning notice is an incomplete list, not a punishment. It is given to all medical practitioners during time of registration. Once you register in the state medical council, then this list is given, which is warning notice for all. And this warning notice is basically rules. These are rules. Professional secrecy. So patient information must be kept confidential. It is an implied contract between doctor and patient. Disclosure can be done only on patient's consent. Okay, if the patient is consenting that you can disclose my information, then only disclosure can be done. Without consent, it's punishable. Breach of professional secrecy. We have an exception to professional secrecy, that is privileged communication. Exception to professional secrecy. Information without consent of patient to the concerned authority. In what conditions this privileged communication is done? Privileged communication means a person's information can be shared, okay, can be shared to the relevant authority, to the relevant person without consent. In what conditions? If there is a community benefit, for example, notifiable condition, death, birth, MTP, TB, cholera, COVID, all of these are notifiable conditions. If a person is suffering from TB, it is a notifiable disease. This is a notifiable disease. Okay, so you have to register the patient and inform the relevant authorities for the TB card and the Nikshay portal. Okay, in case of venereal diseases, okay, you have to educate and inform the close confidentiality of the patient. In case of crime, you have to inform the police as per 33 BNSS. If it's not done, it's punishable. 33 BNSS deals with the communication given to the police. In case of color blindness in a driving job, you have to inform. In case of infectious diseases, you have to inform the public health authority like EDMO and CDMO. Okay, for patients benefit, these were for community benefit. For notifiable condition, venereal disease. In case of crime, color blindness, infectious disease. For patients benefit, like melancholia, suicidal tendencies. If a patient has melancholia, suicidal tendencies, then guardian must be informed and must be asked to keep vigilant, right? In interest of self, if negligence case is filed against a doctor, if a doctor is being filed for negligent cases, then you have to inform, you have to defend yourself, right? It's important. In court of law, in case of court ordered examination negligence cases, you have to disclose the information in court of law, but only if it is asked. Okay, Red Cross emblem, this was an emblem, is not to be used by medical practitioners. Just remember, this emblem must not be used by medical practitioners. This type of emblem is used in which a snake is there, and this type of emblem is used by doctors. This is used by Red Cross movement or Army Medical Services. If this emblem is misused, then 500 will be penalty and forfeiture of this vehicle in which it is used, right? Vehicle can be forfeited. 5th century, Hippocratic oath was some declarations are there, like Tokyo Declaration for governing torture. You can remember TT. Helsinki was the human experiment, first for human clinical trials. This Helsinki was introduced, right? And then we'll have Geneva for medical ethics. This was also for medical ethics. This Helsinki Declaration was then implemented as GCP guidelines, that is Good Clinical Practices Guidelines, and based on GCP, then we'll have ICH, okay, International Committee for Harmonization, ICP, GCH guidelines, based on which our clinical trials, phase 1, phase 2, all are there. Geneva for medical ethics. Oslo for therapeutic abortion, okay, O and O, this and Oslo. Sydney for organ transplantation. Venice for terminal illness. Lisbon for patient rights. Malta for force feeding or hunger strikes. Washington for biological weapons. Okay, in which this Tokyo is important, Helsinki is important, Oslo is important, and this Washington is important. Okay, these are not much asked. Medical negligence, known as professional negligence or professional malpraxis. This is a term. It may have two aspects. One is the omission of right things. If a doctor does what is to be done, if a doctor doesn't do that. Omission of right thing or commission of wrong thing. If a doctor does what he is not supposed to do, it is a commission of wrong things. Omission of right things or commission of wrong things which causes damage to the patient is called as medical negligence. Okay, so absence of reasonable skill or care. Reasonable, you can't expect an MBBS graduate to perform a cesarean section independently, right? It's absent reasonable. He or she should be able to like suture some wounds and prescribe some common medicines for and diagnose conditions, right? Like that. Reasonable skill or care or willful negligence of doctor during treating a patient. Okay, willful negligence of doctor during treating a patient which leads to damage to the patient is called professional negligence. Absence of reasonable skill or care or willful negligence of doctor during treating the patient which leads to damage to patient is called professional negligence. It's a Bolam's test. One test is there which is called Bolam's test. What is Bolam's test? Bolam's test says that a doctor is not liable only when he practice standard guidelines or standard accepted practices. Okay, so let's say it's a defense for doctors. So let's say a doctor is treating a patient for fever based on the standard treatment guidelines, STG, standard treatment guidelines, and patient suffers from let's say some complication. Now if the patient sues you in the court, that the doctor is responsible, you can very well say that the patient was on standard treatment guidelines, okay, and can escape it. So it's called Bolam's test. And if it is not or are not standard treatment guidelines or not, it will be assessed by the expert witness. Another doctor of different one will be like appointed to determine if the if the doctor has really followed the standard guidelines. Essential ingredients of this to prove a charge of negligence, 4 Ds. Okay, so if doctor is said to be negligent, or has committed malpractice or is acquitted of professional secrecy, then 4 Ds must be satisfied: duty of care, dereliction of duty, direct causation which leads to damage. Duty of care, a doctor may or may not accept the case. If in government hospital you have to accept the case, but in a private setup, let's say, you may or may not accept the case. If you don't want to accept, you can just say the patient that this I can't handle this case, you can go to another doctor. Okay, then you haven't assessed the cases, you are not responsible for this. If you have accepted the case, the doctor has to treat, the doctor has the duty of care. If you have accepted the case, if you have admitted the patient and the patient dies under some negligent act, then you have the duty, then you have the care duty which you are not you can say doing. Okay, so if accepted, the doctor has the duty of care. If you have not accepted, then it's fine, but if you have accepted the case, then you have to treat it. No matter what, you have to treat the patient. Dereliction of duty is neglect or breach of duty. If you are breaching or neglecting the duty, it's called dereliction of duty. Due to acceptance without adequate skills, you are admitting a serious pediatric patient, but you don't have the setups, okay, and you don't have a skill in critical care, and you are adapting and you are just keeping some patient like that. Okay, so acceptance without adequate skills. Choosing wrong treatment. Okay, if you will choose a wrong treatment which was not in standard treatment guidelines, then also you are responsible. And administration of medicine and procedure incorrectly, incorrect procedure, wrong medicine, and acceptance without skills, and in these cases you will be sued by the patient. Then direct causation is just follow the sequence: duty, dereliction, direct causation, damage. Duty, dereliction, direct causation, damage. Direct causation means a negligent act is the direct or proximate cause. Okay, remote damage, doctor not liable. Okay, it's a proximate cause or damage to the patient, means the negligent act only leads to damage. If the negligent act only leads to damage, this is called direct causation. And in this, the doctor is responsible. Let's say a patient is there and doctor has some negligent act, but not much, not very serious. the patient again goes to another doctor and suffers the damage. So here your negligent act is not proximate to the damage, is not next to the damage. Okay, so you are not responsible in this case. You can very well tell the patient to sue the another doctor because he was the proximate cause, right? So direct causation will be responsible, the doctor will be liable for damage, and damage is monetary loss, pain or suffering, worsening or disability or death of the patient. It must be foreseeable damage. Okay, you can't just sue the doctor for anything and everything. It must be anticipated damage. Damage must be reasonably foreseeable. Okay, this is the fifth element according to some books, but we have four major elements, that is duty, dereliction, direct causation and damage. Types of negligence: civil negligence, criminal negligence. Civil negligence is simple lack of skill leading to the damage. Okay, not gross. It's a civil one, like wrong dose of medicine, wrong prescription. This is a civil negligence, not much serious. Parties are patient versus doctor. Patient goes to the civil court or consumer court. Okay, and if any patient is treated free, he or she can file the case against the doctor. If free treatment is also there, then also he or she can file the case. And burden of proof lies on the patient. Burden of proof lies on the patient. Criminal negligence: civil negligence first, and second is criminal negligence: gross, willful, wanton, culpable, utter carelessness or illegal act. This all adjectives are very important. Gross, okay, it must be not a small thing, it will be a gross thing. Willful, wanton means it's a willful thing, it's not something that doctor must have seen. Okay, and culpable or utter carelessness, very severe carelessness, the person. Okay, like wrong side surgery or wrong patient. You operated on a hernia patient and it turns out to be a common man, the attendant of the patient. Okay, or if you did a wrong limb amputation. Okay, you amputate the right limb and you amputate, and wrong side surgery. Okay, wrong blood. This is a very important thing. You have to check the blood before transfusion. You can't give a positive to a B negative patient like that. Okay, foreign body inside, you left a seizure inside, wrong medicine, loss of vision. These all are gross errors. And if the patient wants, he can just go and sue you in the court, in a criminal court. Okay, parties are prosecution versus doctor. Burden of proof lies on the prosecution. You have to prove it. In this civil court, judgment is by monetary compensation. The doctor has to pay a particular amount, which is called damages. Damages is a particular monetary amount paid by the doctor. This judgment is fine or jail imprisonment under 106 BNS. 106 BNS is dealing with this imprisonment of doctors for gross and willful negligence, criminal negligence. 125 BNS, any rash or negligent act endangering patient life. If any negligent act is endangering the patient's life, no damage. Okay, then 125 BNS. 125A and 125B, any rash of doctor. Okay, any negligent act of doctor causing hurt. If the doctor is having any performing a negligent act, okay, and it is causing hurt, simple hurt, then 125A. And for grievous hurt, a doctor is doing endotracheal tube intubation. Okay, endotracheal tube intubation, and accidentally he breaks a teeth of the patient, then it comes in the grievous hurt, and the doctor can be booked under 125B. 106 BNS, I told you that any criminal negligent cases are dealt under it. Death of the patient, 2 years imprisonment can be there to the doctor. 131 BNS is assault of patient, okay, without consent surgery. 271, 272 are there. Any act due to which a infection spread. Let's say you admitted a TB patient in the normal ward, and now the normal ward is suffering from TB. Okay, patients are suffering from TB which were previously non-TB. Then so any fatal infection Okay, any negligent act causing fatal infection, 271 BNS. Let's say the doctor knows that there is a TB patient, he isolates the TB bacilli, and does something so that TB is spread to another patients. So any act with malignant intention, the doctor is having malignant intention here. So any act with malignant intention which causes the spread of infection is under 272 BNS. Okay, we have something called contributory negligence, which is applies for civil cases only. Doctor has done for some negligent act and the patient has contributed in it. Burden of proof lies on the doctor. Doctor has to prove it. Okay, and if we can prove it, then the fine will be less for the doctor. So it is a defense. It is a defense for doctor. It is a defense for doctor. Means what you are telling, that contributory negligence means the doctor is responsible, I know, but patient is also partly responsible. If the doctor can allege in the court that the patient has given incorrect history, improper follow-up, improper medication taken, you ask the patient to take 2 tablets per week or let's say per day, and the patient is taking 4 tablets per day, this is a improper medication. You ask the patient to come after 15 days, the patient comes after 2 months. Improper follow-up, the person is not telling that he or she has been to South Africa or South America. So how will you know that you must be suffering from any leishmaniasis or some conditions, right? So if the patient will sue you in the court, then you can very well tell that there is no such history given by patient. Then doctrine of comparative negligence, to determine whose contribution is more or less, it is used by judge. Okay, so one is contributory negligence, one is comparative negligence. You have to know the difference. Contributory means doctor and patient are both liable and both will share a negligence. Comparative is who is more negligent, either doc is more negligent than patient or patient is more negligent than doctor. It is used by the judge to determine. We have some doctrines which called last clear chance doctrine. Last clear chance. When 2 parties are wrong, one who had the last clear chance to avoid the damage is liable. Okay, means you told the patient to go to hospital, the patient goes to a quack, the patient was ill, you ask the patient for referral, you referred the patient and the patient goes to a quack. Okay, so and the patient is suing you for your negligent act because he is more ill now. So you can tell that I had asked the patient to go to the hospital, another hospital, and the patient is going to the quack. So patient is liable here because the patient has the last chance to avoid the damage. Patient had the last chance. If he had gone to the hospital, then he or she had the chance to avoid the damage, but the patient preferred a quack. Okay, so when 2 parties are wrong, one who had the clear chance to avoid the damage is liable. This is called last clear chance doctrine. Avoidable consequence rule, doctor is negligent but duty of patient is to avoid further damage, so patient is liable here. Okay, doctor is negligent, no doubt, he or she must have done something out of hurrying or some hurrying mood. Okay, doctor is negligent but duty of patient is to avoid further damage, right? Avoidable consequence rule, so patient has to avoid further damage, so patient is liable here. Okay, patient is liable here. Okay, then another thing, res ipsa loquitur. So what is res ipsa loquitur? Fact speaks for itself. Okay, it is applicable in gross negligent act, means you don't have to say anything, you can't give any defense. It is very obvious that you have done the negligent act, like doing surgery on wrong side. You don't need investigation, you don't need any expert witness. Okay, the judge can himself see that you have done surgery on wrong side. No TT injection. The person is having a road RTA, road traffic accident. He is coming for TT injection. You haven't done, then tetanus will be onset there. Okay, no TT injection. You will be responsible. Foreign body. Burden of proof lies upon the doctor. Doctrine of common knowledge. No need of expert witness. Doctrine of common knowledge. If the person, this common knowledge is possessed by the common people, right? So if a doctor is not possessing that, okay, if a doctor is having a negligent act related to that, he is not giving IV fluid for dehydration, which is a common knowledge. We give IV fluid for dehydration. Okay, if a doctor is not doing that, then he or she is liable. Doctrine of calculated risk. Okay, we have some doctrines. So first one is the res ipsa loquitur. Okay, last clear doctrine, last clear chance doctrine. Then avoidable consequence rule. Res ipsa loquitur, I told you, fact speaks for itself, right? Doctrine of common knowledge. Doctrine of calculated risk. Every risk or procedure has a certain risk of damage. Every procedure has a certain risk of damage. Okay, so doctor is not liable if he has conveyed this to the patient. Doctor, let's say a patient has come for cesarean section, doctor will tell that we have 0.1% that the patient can die. 0.1% chances the patient can die. If after conveying this the patient dies, then you can very well tell in the court that the patient was well informed of the risk. Okay, so doctrine of calculated risk is also a defense for doctor. You can very well make the patient and the patient's attendants about informed about the risk of this. Novus actus interveniens. Okay, novus means new, actus means act, and interveniens means intervening act. Let's say you have done a negligent act, but after this damage is done, but there is a new act which is directly leading to the damage. Okay, if this new act wasn't there, then you will be responsible for damage because you are the proximate cause. This is like the proximate cause principle. But due to this new or intervening act, a chain is broken and the doctor isn't liable. Let's say RTA, road traffic accident. You are treating the patient. Let's say Dr. X was treating the patient. After this, patient went to shock. Dr. X was treating the patient, and after this, patient went to shock. And in shock, blood transfusion was given, and another doctor prescribes blood transfusion, which led to death. So will you be responsible? Will Dr. X be responsible? No, because there is a sequence break. This Dr. Y, he must have given mismatched blood, so that Dr. Y is responsible. So you have to see the proximate cause. The proximate cause will always be responsible. Another thing, vicarious liability. Superior is responsible for negligent act of the third party. Okay, this is coming under respondent superior. Let the master answer. Hospital administration will be responsible for negligent act of the employees, of the interns. This is vicarious liability. The administration, the superior, will be responsible for the act. Okay, applicable for civil cases only. Criminal cases you will be responsible only. Product liability means if a faulty medical device or drug, if you are inserting a Foley's catheter and due to some reason the person is suffering from any trauma, okay, and you check the catheter and say that there is a problem in the catheter, so will you be responsible? No, it will be the manufacturer responsible. The manufacturer will be liable, right? Borrowed servant doctrine. What is borrowed servant doctrine? If a servant is borrowed for an act, the new temporary employer is liable for the negligent act. Borrowed servant. Borrowed servant. Borrowed servant means if a servant, let's say a doctor is employed in let's say hospital X, but hospital Y takes the doctor. Hospital Y takes the doctor for some days for some consultation. In this period, he does a negligent act. He does a negligent act. So will hospital X be responsible? No, hospital Y will be responsible. If a servant is borrowed for an act, the new temporary employer is liable for the act. Okay. Captain of the ship doctor. Captain. Who is the captain of the ship doctor? This is a variant. If any staff does a negligent act, main doctor is responsible. If the intern does an act, then HOD will be responsible. Okay, like this. Captain of the ship. Who is the captain? Who is the superior one? Like that. So you have to know the terms. Vicarious liability. All are used interchangeably. Okay, you have to know the exact lines. Product liability for faulty medical devices, manufacturer responsible. Borrowed servant, one new temporary employer will be responsible. And captain of the ship doctor, which is the main doctor, will be responsible. Let's say staff nurse is doing a negligent act, then the doctor under which she was working will be responsible, right? Okay. So what defenses you have? Okay. So we'll learn now what defenses you have. A doctor always has defenses. Defenses will save you. To save you in negligence. To save you in negligence, doctor has defenses. First is denial of duty or denial of dereliction. Okay, the doctor can say that I had denied duty, but the patient forced on me. Okay, so I had to do this. Here, who will be responsible? The patient will be responsible, right? Denial of dereliction means that the doctor can allege that treatment was as per the standard guidelines. So the damages suffered by the patient was not valid. Okay. So the doctor can be acquitted of the charges. The charges can be dropped. Double jeopardy, which is called res judicata. Res judicata. A individual cannot be tried twice for same offense of same facts. Okay. The patient is the doctor is acquitted by one court. Doctor is acquitted by one court. Now the patient who is the complaining of negligence moves to another court for trial. So this doctor cannot be tried twice. Cannot be tried twice. Okay, cannot be tried twice for the same offense and the same facts. Same offense, same evidence, everything was different courts. Person cannot be tried. Double jeopardy is a defense. A doctor can tell that you have sued me in one court and you can't sue me in court too. Sorry. Accidental act or unincidental act or misadventure, which is called therapeutic misadventure or diagnostic misadventure or experimental misadventure. Okay, any act which the doctor is not aware of, he can't predict the risk, then the doctor is not liable. Okay, you know that tetracycline will cause bone and teeth defects. And if a patient is suing you for this giving tetracycline in this case, then you will be responsible. But you are unsure that can omeprazole cause colorectal cancer. You don't know. Can omeprazole cause colorectal cancer? You don't know. There is no such text available. So if a patient sues you for this colorectal cancer, and tells you that this omeprazole was causing it, then you can very well escape by giving that you don't have any text to support it, so it was a therapeutic misadventure. Okay, Mal-occurrence, same thing, proper attention to the patient, still no improvement. Doctor is not responsible. Our bodies are designed in that way that one drug can work for patient A, but the same drug may not work well for patient B, and if the patient B conditions deteriorate, and this drug was in the standard treatment guideline, patient cannot make negligent charges on you because it is mal-occurrence. Okay, you gave proper attention, you gave correct drug, correct dose, correct prescription, everything, but still there is no improvement, then this is a mal-occurrence. Voluntary not fit injuria, that is on table death of a patient for CABG. Okay, to a willing person, you told the person that if I do CABG then you can die. So you told the patient that the patient can die after CABG. Okay, the patient is willful, the patient has given you the will that okay, there's no problem in that, I'm ready for the procedure, then you are not liable if the patient dies on table death of a patient for CABG. Res indicata, what is res indicata? This is a limitation period. I told you first res judicata. Res judicata was the condition in which for same offense, same fact, same evidence, a doctor cannot be tried, right? So res judicata, for same offense you cannot be tried twice. In res indicata, this is limitation period, time period which victim has to file the cases. Okay, means the patient suffers from a damage but is suing you in the court, filing a case after 3 years of damage, then this is not valid at all. You can apply the res indicata principle and get rid of the patient or his complaints, right? If a patient is filing the court within 1.5 years, within 2 years, less than 2 years, then only the case is valid. If he is filing the case after 3 years, 4 years, 5 years, then it is not valid. Only for civil cases, note it. For criminal cases, the patient can file the court after any number of years. So res indicata is basically for civil cases, and it's a time period. 2 years is the time period within which he or she can file the case, negligent case against you. Novus actus intervenens, I told you what is that. New act intervene. Contributory negligence, you can very well allege that patient is also responsible and prevent the damage. Doctrine of calculated risk, you will tell that it was a calculated risk, patient was well informed of the risk, so I don't have any it's not my problem. Okay, you can tell that. Product liability, doctor prescribed medicine drug X but it was defective, so and it suffered no damage to patient, so manufacturer will be liable. Burden of proof liable on the manufacturer to prove that our drug is not that defective. Okay, so these are the defenses which you can use if a patient has filed a complaint in the court, okay, the consumer court, then you can use the defenses. Okay, what are the defenses? Denial of duty, dereliction, double jeopardy, then res judicata, okay, for same offense, same fact, trial. Accidental act or unincidental act, mal-occurrence, voluntary non-fit injuria, then res indicata, limitation period, novus actus intervenens, contributory negligence, calculated risk, and product liability. Okay, professional misconduct, what is the definition? I was talking about professional misconduct. This is a proper definition. It is the conduct which is considered reasonably disgraceful and dishonorable by professional brethren of good repute and competency. Any conduct which is disgraceful and dishonorable by a good professional brethren of good repute and competency, by doctor. Let's say any disgraceful or dishonorable conduct by doctor is accounting to professional misconduct. Duties of medical practitioner, treatment of the patient. He or she has to establish a doctor-patient relationship, which is the implied consent, right? Doctor-patient relationship. Doctor-patient relationship is not established in emergency. If he is examining an employee before appointment, if he is a life insurance purpose, medico-legal case, okay, in these cases there is no doctor-patient relationship. Medico-legal, emergency, before appointment, you can't establish with a cadaver, okay, you can't establish a rapport or a doctor-patient relationship with a patient suffering from pulmonary embolism and stroke, okay. Duty to continue the treatment. If the doctor has a duty, if he has accepted a patient, then the burden of responsibility shifts upon the doctor. The duty of care is possessed by the doctor himself. If he hasn't accepted, then it's the other thing, he is not responsible. But if he has accepted, he has to continue the treatment. In which cases he can discontinue the treatment? A doctor can discontinue the treatment if the patient is feigning illness, if the patient is maligning, means the patient is having no illness but is acting like he or she has illness. Using random medicines, you prescribe paracetamol, the patient is using chloramphenicol, okay, random medicine. Consulting another doctor without informing, he is going to Dr. Gupta and also going to Dr. Sharma and also going to Dr. Yadav, okay, another doctor without informing. Patient is not paying fee in private setups. Patient is coming and just is not paying fee and just going and checking out without any doctor fee. You can just tell the patient that if you will not pay fee, I will not discontinue the treatment, okay. Doctor himself falls sick. If he falls sick, then how will you continue the treatment? Okay, these are the conditions in which doctor has a right to stop the treatment. Exercise a reasonable degree of skill, care and knowledge. The doctor must exhibit a reasonable skill, care or knowledge. No experiment, only treatment plan, only standard treatment guidelines. Extra care and precautions to dangerous and habit forming drugs. You are prescribing benzodiazepines, barbiturates, okay, you have to take extra precaution. Proper instructions, legible prescription. Legible prescription is important. Rational prescription must be written in block letters, must contain only the generic names of medicines, okay, and instructions must be clear, advices must be given, okay, all of these things. EMRB, I told you, maintain national register, professional conduct, medical ethics, appellate jurisdiction by SMC level. So if a patient is if a doctor is not satisfied by SMC, he can appeal EMRB. If if the doctor is not satisfied with EMRB, he can appeal NMC, okay, can appeal NMC. Medical advisory council, a medical advisory council is also there, okay, MAC. Chairman is the chairman of university grants, chairman of NAAC, and members nominated by all of this, okay, not much important, just a council. State medical council, I told you, it's an autonomous body maintaining the medical register. Disciplinary action. Warning notice, what is warning notice? I told you, A, B, C, D, E, F, G, H, okay. This advertisements, alcohol, abortion, okay, all of this, adultery and all. B, bribe, commission, and C, all of this, okay. Warning notice. Let us revise it first, okay. If you have forgotten, just let me show you. Addiction, alcohol, association, abortion, advertisement, adultery. B is bribery. C is conviction, commission, covering. D is dichotomy, fee splitting. E is endorsement of any medical company or brand. F is false certificate. G is gift, okay, all of this, okay. Then let's continue. There is a difference between warning notice and warning. Warning notice is a circular circulated by SMC periodically describing the professional misconduct. It's a circular by the SMC and it's describing the professional misconduct. Warning is cautionary notice after SMC, Okay, there's a difference, just understand. Warning notice is given to all doctors, all RMPs. Warning is given to only who is facing negligence. This is also given by SMC, this is also given by SMC, State Medical Council. Okay, but this is given to all doctors. It has a set of rules and regulations. Warning is a cautionary notice given to SMC. So any complaint out of law, registrar will be submitting to the president. President forms a subcommittee. Subcommittee will have doctors of good repute. Okay, doctors of good repute, and will have odd number of members. They will discuss if the doctor is guilty or not, right? Advantages of registration. So what are the advantages when you get a registration number? Okay, you are getting a registration number from NMC, right? What are the advantages? Right to choose patient, not for a state government, for central government. Okay, for not in emergency also. Okay, if a patient is in emergency, if you are running a private clinic or private setup, then also you have to treat. Okay, provided you have proper infrastructure. Right to add title. Okay, you can add your title, MBBS. Right to claim reasonable fee, not a government setup. Government setup will have salary. You can claim reasonable fee. You can't claim more fee also in private setups also. Right to prescribe medicines, right for appointments, right to conduct autopsy, give evidence, be an expert witness, issue medical certificate, right to remove eyes for organ transplantation. All of this you can do after registration. Okay. Consultation, if in which cases, let's say you are a doctor but you have to consult a cardiologist. In which cases you will do? If patient requests, if the patient is telling you that doctor, please, I am sitting here and you please consult a neurology or a neurologist, a friend of yours or something, okay, and I want his opinion also, then you have to do. If you're not sure about diagnosis, you can consult. During treatment of criminal abortion, you will require the opinion of another doctor. In homicidal poisoning, okay, all of this. Okay, duties under Geneva Convention. 4 conventions are there by Geneva. Okay, by Geneva Convention, 4 conventions are there. First, wounded sick personnel of army. Second, shipwrecked person. Third, prisoner of war. Fourth, civilian of enemy country. Okay, these are the 4 conventions under Geneva. Not much important, but you have to know the 1, 2, 3, 4. They may be asked in the MCQ. First, wounded or sick personnel of army. Shipwrecked. Second, ship. Third, war, WAR, 3 letters, 1, 2, 3, third one. And fourth, civilians of enemy country, enemy. So fourth, enemy. First is A is for army, and second, ship. Okay, these are the emblems only during wars, only used by army personnel during wars. You can't use just by doctors. Okay. In medical negligence, we give a definition of act of commission, act of omission. What is commission and omission? I told you earlier, right? Commission means doing something which is not supposed to do, or omission means failing to do something which one is supposed to do, right? Which leads to bodily injury, suffering, or death. Okay, I told you all error of judgment, contributory negligence. Okay. LAMA, what is LAMA? Leaves hospital against medical advice. If a person is leaving the hospital without medical approval, okay, without medical approval, you leave the hospital and go to another hospital, then you can't sue the doctor of the previous hospital because you are LAMA. The doctor will report you as LAMA, leaves against medical advice. Res judicata, I told you, negligence cleared by lower court. Patient is not allowed to take the plea to the higher court. Doctor can appeal for the same. Okay, patient is not allowed to take the plea for a higher court. Okay, So let's discuss about some other things which are just side things, and then the act. Okay, let's discuss Consumer Court. Consumer Protection Act CPA, to bring transparency in business or industrial sector. This act was brought into play. Quality goods at regulated price, after sale service, avoid time consuming and costly court procedure, covers all. Service rendered by doctors was brought under CPA in 1995. In 1995, this CPA was applicable to doctors to enact speedy and cheap remedy. As per CPA, patient is the customer and doctor is the shopkeeper. Okay, patient is the consumer, doctor is the shopkeeper. Consumer Court are 3 strata: District Consumer Redressal Forum (DCRF), District Consumer Redressal Forum, State Consumer Redressal Forum, okay, and National Consumer Redressal Forum, New Delhi. Okay, these are the 3 levels of Consumer Court. District 1, 5 lakh compensation. State, 5 to 20. National, more than 20. 5 lakh, 5 to 20, more than 20. Okay. District judge is the president here and 2 other citizens, and 5 lakh compensation. State high court judge will be there and 2 eminent citizens, 5 to 20 lakh. National Supreme Court judge will be the president and 4 others, 1 lady, 20 lakh compensation. This is about the Consumer Court: 5 to 20 and more than 20. And here district judge, state high court judge, Supreme Court judge. Here 2 other citizen, 2 citizen, 4 citizens. Procedure: complainant will lodge a complaint. He will go to the Consumer Court. Court issues notice to the opponent. Okay, court issues notice to the opponent. You have to give the reply within 30 days. If you don't give a reply, then 1 more chance, and after reply there will be verdict, there will be hearing. If the lab test is not done, the hearing will be completed within 90 days, and if the lab tests are involved for hearing, then it must be completed within 150 days. So maximum duration the court will listen to you is 150 days. Okay, presence of lawyer is not necessary. You can yourself just give evidence now. Complaint will be rejected if more than 2 years. What is called? This is called as limitation period. Limitation period, which is called res indicata. Okay. Medical indemnity insurance. This is medical practitioner during professional work, risk of facing medical negligence charges. So there is an insurance. So against such charges, there is a medical negligence insurance for doctors. If a doctor is having negligent act and a patient asks, the court directs him to pay 5 lakh compensation to the patient, and the doctor may be facing some problems. So if he had the insurance earlier, then there will be no problem for the doctor. So it's a insurance, medical indemnity insurance. Malingering is basically a deliberate attempt or conscious pretending a disease on the part of patient. Patient is consciously pretending a disease. Okay, like soldiers and policemen to avoid duties. Police have a very strict rules. Okay, and the work culture is like that. So there will be always duty emergencies and night shifts, and also soldiers or policemen, usually to avoid duties, they pretend to be ill. Prisoners, businessmen, politicians, okay, all of this. Signs and symptoms do not match any known disease. Okay, if it is not matching any known disease, keep under observation without him watching knowledge. In these cases, you have to keep him under observation and without his knowledge. Okay, let's talk about PCP&DT Act. Preconception and Prenatal Diagnostic Technique Act 1994. PCPNDT Act was enacted in 1994. Prohibition of sex selection before and after conception. Okay. Purpose to prevent female feticide. So in India it is there only, and other countries like Thailand and all, it is legal to determine sex before conception, before and after conception. So in India there is a increased female feticide, right? Increased female feticides. So for that people kill female fetuses. So to prevent that, the sex selection cannot be done, okay, beforehand. If it is done, action is taken by SMC. Medical records. What is medical records? Medical records are confidential records. Hospital has right to use for statistics and quality care determination. Hospital can't use the personal details of the patient, but has the right to use for statistical or quality care. For statistical studies, hospital can use. Next of kin can get the record in case of patient death. If a patient has died, the attendant, the next of kin, the son of the patient, can get the record. Medical records. Physician should maintain the record for 3 years from commencement of treatment. Physician must at least for 3 years he has to maintain. But if it is a medico-legal case, if a medico-legal case is there, okay, medico-legal case, then it has to be preserved for 30 years, 10 times more, 30 years. So normal case, physician should maintain the record for 3 years and computerized format, and medico-legal case he has to maintain the record for 30 years. Okay, so that was about medical negligence and medical ethics. Let's move on to the next part. Now let's talk about consent. What is consent? Consent is basically an agreement, a permission or compliance. APC, agreement, permission, or compliance. When two or more person consent, they agree upon the same thing in same sense. Okay, if a person A and B are consenting, they are agreeing. So it's given by section 13 of Indian Contract Act. It's a contract. Okay, so basically contract. Section 13 of Indian Contract Act is governing consent. Examination or treatment without consent, assault. It will result to assault of the patient. If you are not taking consent and you are doing a procedure, it will lead to assault to the patient. Even it is for best interest, it doesn't matter, but the patient will be assaulted. Name. Okay. Types. What are the types? Implied consent, consent by gesture. A patient has come to your clinic for treatment. It is an implied consent that the patient wants you, has no problem for you to check him or stethoscope. Okay, you don't ask the patient while you are checking him via stethoscope or something like that. Okay, you don't ask the patient, you just check the patient. No need to ask. Okay, so implied consent. Expressed consent is the best one, verbal or written. Okay, person has consented to something verbally. Okay, written, very good. Best consent is the written expressed consent. Written informed consent is the best consent. Okay, so there is surrogate or proxy consent given by another person. Surrogate consent. If the child, if it's a mentally ill person, intoxicated person, then guardian or parent can give the consent. You use proxies in your classes, right, for attendance, right? So surrogate proxy consent is like that. Person is not there, the person not fit mentally or intoxicated, then guardian or parent or any let's say the patient is staying in a rented house, then the house owner can give the consent. Open consent, generic consent, or blanket consent. Open consent or generic consent. Open or generic consent or blanket consent is basically one consent for all investigations. You are taking a blanket consent and doing any procedure of your choice on the patient, but it is invalid in India. In India, you have to take the consent for each and every procedure. Okay, Authorized content is mandated by court or law. A procedure can be done with reasonable force if authorized by law. If law gives you permission, then you can do any procedure. So starting with the doctrines, doctrine of full disclosure means you will give complete information to the patient. No matter what, you will give complete adequate information to the patient. If you are not giving if you are giving inadequate information, it doesn't mean any consent. So consent means a full disclosure. Doctrine of partial disclosure. Now I told you, sir, that it's a full disclosure. What is partial disclosure? Therapeutic privilege. It's an exception for full disclosure. So even giving partial information to patient, for patient's benefit, then it's called therapeutic privilege or partial disclosure, right? Let's say you gave very less information to a psychiatric patient. They don't usually they are suffering from mental illness, right? So it's not good for them to hear that they are mentally ill, right? So don't tell the patient. You tell the patient, inform the patient or guardian, to inform the case to the guardian. So it is therapeutic privilege. Doctrine of informed refusal. So patient has the right to refuse the treatment, and the document has informed refusal. Patient sign is taken. So patient can refuse it. Patient can refuse the treatment. Doctrine of informed refusal. Doctrine of extended consent. Consent for specific procedures. During procedure, new issue arises. Doctor extend consent for additional condition. Doctrine of extended consent means the doctor is let's say operating for some condition X. So extended consent means you are doing procedure X, but the patient requires an additional surgery Y, then you have to take the consent for that procedure also. So if a new issue is arising, then the doctor can extend the consent for additional conditions. Only for life-saving operations, you don't need to wake up the patient again and take consent and again put under him in general anesthesia or spinal anesthesia and do the procedure. Not like that. If a patient is in cesarean section, okay, and after that PPH occurs, you don't have to wake up the patient after spinal anesthesia and take a consent and do management of PPH. Okay, you can do accordingly. So it is extended consent. It's not a blanket consent, not an open consent. Okay. Doctrine of therapeutic waiver. Patient is waiving his right of consent and authorizing someone else to give consent for him. Doctrine of therapeutic waiver means the patient has deployed an relative, let's say relative, for giving consent. So the relative will give the consent. You don't need to ask the patient again and again. Doctrine of emergency. Consent is non-mandatory in life-saving emergencies. A person is in shock. You will not waste your time in asking the patient whether or not he want noradrenaline. Okay, you will give it noradrenaline like injections. You will give it like that. Okay, so it's an emergency. Doctrine of emergency. 30 BNS. Consent is non-mandatory in cases of life-saving emergencies. Okay. Doctrine of loco parentis. What is loco parentis? Child less than 12 years, person in charge gives consent. Okay, so the guardian, the house owner, the orphanage head, they will give the consent for any medical procedures for child less than 12 years. This is called loco parentis. A consent is valid only when it is free and voluntary, not with force. You can't forcefully take a consent. Okay, a valid consent is governed by 28 BNS. So if a person is charged of 28 BNS, he or she is charged for no coercion, that is no forcing, physically competent. Okay, person who is giving the consent must be physically competent, sound mind, sane person. You can't take a consent from insane person and say that the consent is valid. No influence, no fraud. Okay, this is a valid consent. Medical examination. What about the consents? General physical examination. Any person above 12 years can give a consent for general physical examination. For major procedures, for surgery, for invasive procedures, for FNAC, like that conditions, will require a age of more than 18 years for consent. If a person is less than 12, then guardian has to give the consent. 27 BNS deals with it. 28, what was 28 BNS? 28 BNS basically is dealing with invalid consent. Okay, 30 BNS is basically doctrine of emergency, that consent is not needed in cases of emergency. Okay, medical legal examination of rape victim accused is not mandatory, 52 BNS. Victim mandatory consent, 184 BNS. Accused, you don't need any consent. Okay, and reasonable amount of force also you can use upon him. 52 and 184, you have to remember this. 52 BNSS, 184 BNSS. BNSS it is. Okay. Autopsy, medical legal autopsy, no consent needed, no consent. Pathological autopsy, consent is mandatory. MTP, medical termination of pregnancy, minimum age 12 years, 18 years. Less than 18 years or mentally ill, legal guardian has to consent. Okay, and consent of female is mandatory. Then consent of female is mandatory. Act is not intended to cause death, done by consent in good faith for person's benefit, not an offense, under 26 BNS. Okay, which is not intended to cause the death, done by consent in good faith for person's benefit. You are doing something for person's benefit, but it caused death. It's not an offense. You are not negligent. Okay, it's under 26 BNS. Act done in good faith for benefit of child or person of unsound mind or by consent of guardian is 27 BNS. I told you that under 27 BNS it is governing a valid consent, and invalid consent is 28 BNS. 28 BNS. Okay. Act done in good faith for benefit of a person without consent, 30 BNS. 30 BNS I told you in case of emergencies in which no consent is needed, without consent, 30 BNS. Examination of under trial prisoner, a prisoner is under trial, consent is mandatory. Examination of convict means a person who is staying in the jail, is prisoned. Okay, then consent can be obtained from jail authority has to give the consent. Okay, if everything is not disclosed to the patient, inability to make a rational decision. Okay, if everything is not disclosed to a patient cannot make a rational decision. This is called paternalism. So what is paternalism? If everything is not disclosed, the person cannot make decisions. Okay, blanket consent, I told you, it covers everything. Okay, let's move on to the next part. Let's talk a little bit about euthanasia. Euthanasia means mercy killing, form of homicide to terminate his or her suffering or incurable pain. So form of homicide to terminate his or her suffering or incurable pain. Let's say person is suffering from cancer and it's the 4th stage, and person is suffering from very incurable pain. Okay, chronic pain, and is on opioids. Okay, so a person is of old age, let's say of 80 to 85 years patient. So if person can request for death because he or she is not ready to suffer more pain, so death is better than the pain, right? So that is euthanasia. Types: active and passive. Passive euthanasia means patient dies of natural outcomes, he or she is abandoned, that is act of omission is done here. It's not negligence. Okay, it's a voluntary act of omission. Means passive euthanasia means you are not doing anything. You are removing the life support, stopping the food and water, not giving CPR, stopping medical support and medications. Okay, all of this will lead to the death of the patient and will be passive euthanasia. And this, very importantly, this is the patient's will. Active euthanasia, causing death by direct action in response to patient's request. Act of commission: overdose of sedative overdose, morphine overdose, heroin overdose, injecting air into veins called air embolism, and death. Okay, this is again of patient's wish. The patient has asked you to kill him so as he can be liberated from suffering or incurable pain. Physician assisted suicide due to carbon monoxide, sedative overdose, you can prescribe it, right? Circumstances. In what circumstances you need euthanasia? Physically or mentally handicapped patient, cancer, AIDS, senile dementia, unforeseen mishap, brain damage, patient is in coma or is in vegetative state for many years. Okay, person is rendered in vegetative state for 30 years. So it is like leading to just the patient suffering, nothing else. To achieve voluntary euthanasia, advanced direction DNR order, that is do not resuscitate. DNR order is do not resuscitate, and self-determination act is that involuntary euthanasia, power of attorney, relatives and guardian can also give authority. Ethical issues, right to life. Here euthanasia is a debatable topic. It's a debatable topic. Many say that euthanasia is good, euthanasia is bad. It's a debatable topic. So right to life, right to dignity, right to self-determination is hampered in euthanasia. Hippocratic oath code of medical ethics is compromised. Hippocratic oath tells that you have to do everything to save a patient, but here you're killing a patient, right? Maybe it's a patient wish, but your Hippocratic oath is compromised, right? So ethical issues are this too, and this completes the euthanasia and our first unit, that is medical ethics, medical negligence, important acts and euthanasia. Let's move on to a very important topic, which is the next topic. So let's start with the topic drowning. Drowning means a force in involuntary submersion into the water. Drowning can be atypical drowning or typical drowning. Atypical is the rare form, typical is the common type of drowning. Atypical drowning may be dry drowning, secondary drowning and immersion syndrome. Okay, dry drowning, secondary drowning and immersion syndrome. Dry drowning, cause of death is laryngeal spasm. Cause of death is laryngeal spasm, that is water has only moved up to larynx, rest of the body is dry. So dry drowning, you understood, cause of death is laryngeal spasm, water can only move up to larynx, rest of the body is dry, commonest among atypical drowning. Dry drowning, secondary drowning. Secondary drowning means cause of death is complication of drowning. The person is not dying of drowning, the person is dying of drowning complications. Immersion syndrome, cause of death is reflex cardiac stimulation due to stimulation of vagus nerve, reflex cardiac inhibition due to stimulation of vagus nerve whenever a person falls in a cold water. Cold sensations are basically vagomimetic type of sensations. Okay, so there is a reflex cardiac inhibition, vagus nerve is stimulated and the heart is depressed. There is a bradycardia, decrease in BP, decrease in heart rate. Let's talk about typical drowning, which is a common one, called as wet drowning. Cause of death is drowning asphyxia. Cause of death is drowning asphyxia. Water in lung. Cause of death is water in lung, which is called emphysema aquosum. So dry drowning, what is the cause? Dry drowning, laryngeal spasm, dry drowning, laryngeal spasm only up to larynx, no other body parts are dry. Wet drowning, the cause of death is water in lungs, the lungs get filled with water, and this is called emphysema aquosum, emphysema aquosum. This is a wet drowning. Wet drowning, how to determine if it is antemortem or postmortem? Antemortem drowning, how to determine if it is fresh water or salt water, or postmortem? What are the indications of antemortem drowning? What are not the indications of antemortem drowning? Okay, you can't tell that this is an antemortem drowning. Not the indications of antemortem drowning: wet bodies or clothes, cutis anserina. Cutis anserina is the goose pimpling of the skin, erector pili spasm. Washroom in hands or feet, which is sodening. It's a bleaching and thickening of the skin. These are not the feature of antemortem drowning. These are features of postmortem drowning. So wet bodies or clothes, cutis anserina, washroom in hands, you can't tell if it is an antemortem drowning. These are not the indicators. Okay. So what are the features of antemortem drowning? Antemortem drowning means person was alive So macroscopic features. Antemortem drowning means person was alive and after that due to drowning the death has occurred. Postmortem drowning means person was already dead. After that he is drowned. So person was killed and thrown into water. This is postmortem. A person has died due to drowning. This is antemortem. Macroscopic features. Cadaveric spasm of drowning, which is the most important and most reliable feature. You will see clenched hands, and if you try to open the hands you will see some debris. So when a person drowns, a person tries to grab whatever he or she has to save himself or herself. A person usually tries to grab on the sea plants and weeds, small sticks, whatever, so that he can save himself, but he is unable to save and drowns. This is suggestive of struggle to survive. Cadaveric spasm of drowning is the most important, most reliable feature. ATP stores are depleted, due to which the hand goes into a spasm. Presence of frothing from nose and mouth, that will be froth. What is froth? Froth is basically the bubbles, the little bit fluid diffused in a gas. Presence of frothing. This is copious, leathery and thin, tiny bubbles. Copious, leathery. This is a classical froth. Okay, and on being wiped up comes back. So it's a huge amount of froth. It's a leathery froth and small tiny bubbles are there. You can see this is frothing. Presence of Paltoff's hemorrhage. Paltoff's hemorrhages. Paltoff's hemorrhage are basically large hemorrhages on surface of lung seen beneath the pleura. Okay, when you dissect the pleura out, then you will see large areas of hemorrhage. These areas you can note, large areas of hemorrhage. Indicative of alveolar rupture due to wet drowning. This is an antemortem phenomenon. Okay, so what are the macroscopic features of antemortem drowning? Macroscopic features of antemortem drowning: cadaveric spasm, frothing, and Paltoff's hemorrhage. Cadaveric spasm, frothing, and Paltoff's hemorrhage. Okay. Microscopic findings. We have to do diatoms test. What is diatoms test? Detection of diatom in bone marrow. In bone marrow, you have to detect diatom. Diatoms are basically unicellular algae which reach bone marrow in a body with intact circulation, means alive person. So whenever a person is alive, the circulation is intact, the diatoms will reach. The diatoms will reach, and due to this reaching of diatoms, it will be detected. Diatoms will reach bone marrow. It will be detected. Okay. Microscopic findings, diatom. So in diatoms will be detected in bone marrow. For it to be conclusive, it is suggestive of active circulation. But mere presence of diatoms in body viscera is not conclusive. We have to check in bone marrow only. You can't confirm it merely. Okay, just only in body viscera. It's not confirmative. Best sample for diatom test: bone marrow femur. So best sample is bone marrow femur. After diatoms test, you will do acid digestion test. So diatoms have silica cell wall, not burned by organic acids. So SADT is done to speed the detection of diatoms in tissue subjected to HNO3 solution in test tube. So you take tissue in HNO3 solution, you will centrifuge it. You will get a clear supertenant and a microscopic residue inside. And if you check the presence of residue, then you will see diatoms. you'll see diatoms. Okay, so basically the acid digestion test is also for detecting diatoms, to check to speed the detection of diatoms in tissue. Okay, let's discuss about freshwater and saltwater drowning. Next, freshwater drowning. So you determine whether it is antemortem or postmortem. You determine. Now we'll check if it is freshwater drowning or saltwater drowning. Freshwater drowning. This is the alveoli. This is the blood vessel. Water here in freshwater is hypotonic because no salt is there. Whenever you add salt, NaCl, some ions will be there. Ionic concentration will increase, solutes will increase, and solutes, when it is increased, it is increase the osmolarity. Due to increased osmolarity, it will become hypertonic. So salt water is hypertonic, freshwater is hypotonic, and blood vessel is hypertonic, comparatively hypertonic. So where water will flow? Water will flow inside blood vessels. Blood flow from hypotonic segment to hypertonic segment. Water flows from alveoli to blood vessels. Alveoli to blood vessels. Water will flow from hypotonic to hypertonic, and blood becomes hemodiluted. Hemodilution will occur. Due to hemodilution, RBC will swell and rupture. There will be swelling and rupture of RBC. There will be hyponatremia. Na will be decreased, and leakage of potassium, hyperkalemia. Leakage of potassium, hyperkalemia. RBC will rupture. What is the most predominant ion inside the cell? Potassium. Potassium will leak out. Potassium will increase potassium in blood. Due to increased potassium in blood, there will be hyperkalemia, and this hyperkalemia will cause cardiac arrhythmia. Cardiac arrhythmias. It will cause cardiac arrhythmia and death within 3 minutes. Very severe cardiac arrhythmia. Lungs will be large and voluminous, able to retain their shape and borders. So lung will be border will be irregular and shape will be retained, but there will be large voluminous lungs. Boggy, large voluminous boggy lungs. Okay. Saltwater drowning. Here water is hypertonic and blood is hypotonic. Blood is hypo. So water will move from hypo to hyper, that is, the water flows from vessel into lungs. Hemo concentration will be there. There is more concentration due to less water. Hypernatremia, and person dies of drowning asphyxia. There will be asphyxia, and mean survival is 5 to 8 minutes. There in your freshwater, this is saltwater. Freshwater it was 3 minutes, and saltwater there is 5 to 8 minutes. Lung is heavy and boggy, unable to retain their shape or border. Okay, it's unable to retain their shape or border, this one. And there will be rib impression. Due to this heavy lung, the ribs will be, there will be compression. It will face resistance from ribs. So there will be rib impression mark on surface of lung. How to differentiate freshwater and saltwater drowning? Okay, how to differentiate? We have something called as Jettler's test. Gettler. Jettler's test. Now it's obsolete. So normal heart has right side 50 milliequivalent per liter chloride, 50 milliequivalent per liter chloride in right and left. But whenever there is a freshwater drowning, hemodialysis will occur. So in right, chloride will increase. In left, chloride will decrease, 25% less. So in right, there will be increased chloride. Left, there will be decreased chloride. In saltwater drowning, hemo concentration, left chloride increase and right chloride decrease. Reverse. Okay. Difference is significant only if it is more than 25%. Then only we can differentiate between freshwater and saltwater drowning. Understood? Okay, so let's make a summary. So drowning in freshwater, let's say freshwater drowning. So in freshwater, what happens? There will be hemodilution. I told you, hemodilution. Due to hemodilution, there will be increased circulatory load, circulatory blood flow will be increased, and there will be RBC rupture. Due to increase, there will be increased blood flow to heart, and there will be overloading. Due to RBC rupture, there will be K plus release, and it will lead to hyperkalemia. Due to this overloading and hyperkalemia, it will lead to arrhythmias like ventricular fibrillation, arrhythmias. It will lead to cardiac failure, and there will be death within 3 minutes, 3 to 4 minutes, some books write. Okay, this is freshwater drowning. You can make a flow chart like this. Talking about saltwater drowning, there will be hypovolemia and hemoconcentration. There will be pulmonary edema. There will be asphyxia. This all hypokalemia, hemoconcentration, pulmonary edema, asphyxia will lead to cardiac asystole. That is no heartbeat at all, and it will lead to death in around 5 to 6 minutes. Some books write 8 to 10 minutes also. Okay, so there is a better survivability in freshwater drowning as compared to saltwater drowning. Okay, and talking about the features, let us make a summary. So clothes, of course, wet, sand, mud. Body, pale, mud particles will be there. Face, pale, putrefied. If there is more, putrefaction is fast here. Eyes half open or closed. Congested conjunctiva. Protruded tongue. Okay, there will be light pink, very important, light pink. Post-mortem lividity. There will be violent rigor mortis. There will be violent struggle, right? So early rigor mortis. All of this. Okay, and about froth, like a mushrooming type of froth. Even if washed away, it reappears. And blood tinge also, due to any pulmonary hemorrhages. If froth is coming, then it will be blood tinged. And I told you about cutis anserina, that is goose flesh, goosebumps due to erector pili. Okay, this goose flesh or goosebump is also called reaction phenomena. Okay, where I wrote here, it is not a feature of antemortem. This is also called as reactor phenomena or reaction phenomena. And cadaveric spasm, I told you. Washroom in hand, I told you that this washroom in hand is there. Palms and soles, and soddening will be there. And this soddening basically when it is around 24 hours. After around 48 hours, there will be degloving. The skin will wear off. 48 hours there will be degloving. Okay, due to prolonged immersion. And this is also not an indication of antemortem. All of this you saw. Internal findings. What are internal findings? I told you earlier. Let me make a summary. These are external findings. What are internal findings? Ballooning of lungs, ballooned lungs. There will be rib markings. I told you, rib markings. Tardive spots and pult of hemorrhage. Tardive spots and pult of hemorrhage. The tardive spots are spot like tiny ecchymotic hemorrhage over subpleura, and part of hemorrhage is basically large areas, mottled red gray areas, red gray mottled areas. Okay, tardive spots are just spot like hemorrhages, spotty hemorrhages. And I told you about emphysema aquosum. In which drowning? Wet. Okay, these all are there. And if I talk about the differences in freshwater and seawater, freshwater, seawater. Okay, talking about freshwater and seawater. In freshwater, ballooned lungs. In seawater, ballooning plus boggy plus heavy lungs. Here regular borders of lung, here irregular border of lung, here emphysematous lung, here it is flattened lung, flattened, soft, jelly like. Here freshwater, this drowning, crepitus is heard. Here no crepitus. Okay, and this all things are there. In a question, middle ear was asked. Middle ear there will be water presence and blood, water or blood presence. Okay, this is a positive proof of drowning. In stomach, we have two important signs. Stomach, we have two important signs. Okay, this blood in middle ear, this is also called Unio's sign. Unio's sign. UNEO, Unio's sign. Blood in middle ear, Unio's sign. Stomach, two important signs are there. Sehardt's sign, Sehardt's sign, and Widler's sign. Sehardt's sign, Widler's sign. These are two important signs in stomach. Sehardt and Widler. Okay, Sehardt and Widler. And for spleen, two important signs are there. Sabinsky and Besnikov. Besnikov is not of spleen basically. Sabinsky is for spleen. This Besnikov sign is basically water in stomach. Stomach, in your middle ear. Okay, this is all water. Here is Besnikov sign, and Sabinsky sign is basically of spleen, in which spleen becomes small spleen. Okay, there is a less red pulp present, small anemic skin, and we have it called something called drowning index. Drowning index is more than, if it is more than 14.1, it is indicative of AM drowning index. Okay, drowning index, all of this. Diatom test, I told you what happens about the diatom test, and these all things are there. Antemortem and postmortem difference I also told you, lungs and all. Antemortem drowning, postmortem. Jettler test is positive in which drowning? Jettler test means acid digestion, diatoms means antemortem drowning. Postmortem it will be negative. Okay, and accidental drowning basically seen in children. Okay, in intoxicated patient. Suicidal drowning is among females. Okay, and homicidal drowning is not much common. Okay, all of these things are there in drowning. Let's move on to the next topic. Okay, let's start with the skull fractures, regional injuries. So skull fractures, here we have a handmade note for other videos, so we'll discuss it only. So first fracture here, look at this. This is a fissure fracture. What is a fissure fracture? Fracture occurs in a single line, like a heavy weapon with a broad surface. Cut this hammer here. Hammer will be not a heavy weapon with a broad surface, it is a narrow surface. So heavy weapon broad surface, and it's the most common fracture. Fissure fracture is done, it's the most common fracture. Second fracture is a depressed fracture. Okay, depressed fracture, look at this. Second, that is a, okay, this one. No, this is not depressed fracture. This is a depressed fracture, and it is also known as signature fracture or fracture a la signature, because if it is struck with a heavy weapon with a narrow surface, then depressed fracture will be there. The skull fragment will depress inside like this, and if intracranial injury is present, then you have to do surgery. But if it is absent, then you will do conservative management. So this is depressed fracture. Third one here, look at this, just sutural or diastatic fracture. So fracture is basically along the sutures. Okay, along sutures. Most common in young adults. Most common overall, which is most common overall? Most common overall is the fissure fracture, but most common in young adults is sutural or diastatic fracture. Okay, then diastatic fracture is done. Then we'll come to ping pong fracture or pond fracture or indented fracture. Ping pong, pond, or indented. So neonatal skull, the skull of infants less than 4 years. Okay, infants and children less than 4 years, they have a skull with significant amount of collagen and elastin. So the skull is a bit elastic, so fracture doesn't occur due to trauma. There is a folding, there is an indentation on the skull, a pond shaped indentation, so it is called pond fracture. There is an indentation, and most common in children. This is the most common fracture in children, and also seen in forceps delivery. When you apply the forceps delivery in OBG, this fracture can also be seen. Okay, this is ping pong fracture or pond fracture or indented fracture. Okay, comminuted fracture is basically fractures in which bone shatters, is segments. There is a segmentation of bone, 1, 2, 3, 4, due to repeated trauma. There is a fragmentation of bones. Okay, repeated trauma. This appears, look at the appearance of the fracture. If you can appreciate, it appears like this, like origin from one point. So it is also called spider fracture or mosaic fracture. Okay, then gutter fracture. What is gutter fracture? Gutter fracture is due to glancing bullet. Basically, when bullet goes tangentially, a gutter fracture is formed. A gutter is found like this. Type 1, type 2, and type 3 gutters. So type 1, type 2, and type 3 gutters. Type 1 gutter is basically the fracture which is involving the outer table. Let me make you understand here. Let's assume that this is the skull, and here inside we have the brain. So the cranium is protecting it. This is the outer layer, this is the inner layer. If a glancing bullet, basically tangential bullet, passes and touches the outer layer, outer table, it's called outer table of skull, this is the type 1 fracture, type 1 gutter fracture. If the bullet is basically involving the inner table, it's a type 2. If the fracture is going straight away from the head here and existing from here, having significant brain injury, so this appears like a keyhole, right? There is an entry point and exit point. So this is a keyhole fracture, or type 3 or type 3 gutter. Keyhole fracture or type 3 gutter fracture. Okay, so this is a type 3 gutter fracture. After gutter fracture, let's move on to fractures of skull base. So fractures of skull base. First fracture is the ring fracture. Ring fracture is basically fracture which is, let's say this is skull base and the foramen magnum. So fracture which is occurring around the foramen magnum like a ring, this is the ring fracture. Let's say in what conditions? Let's say a person falls from height on his legs, then force will be transmitted and base of skull will be fractured. Let's say fraction fell on his buttocks, then also force can be transmitted and there will be ring fracture. Let's say there is a heavy weight impact, heavy weight impact, so will be fracture of posterior cranial fossa and there will be ring fracture. Okay, this is the ring fracture in green. Understood? So with that, come to the last fracture, that is the hinge fracture. So gutter fracture is done. Hinge fracture. So hinge fracture, basically, let me draw a diagram. Focus here. Let's say this is a skull base. Okay, this is a skull base. This is a foramen magnum. Let's say the fracture is extending from like this. This is the type 1 hinge fracture. If the fracture is going from posterior cranial fossa to anterior cranial fossa, the posterior cranial fossa is the anterior cranial fossa, like this is oblique fracture. This is the type 2 hinge fracture. If the fracture is directly in the anterior cranial fossa, this is the type 3 fracture. Okay, these are the examples of hinge fractures. So hinge fracture, in this type 1 fracture, look at this, there will be abnormal mobility of head. The head will be imbalanced, so that is called as nodding head sign. So nodding head sign is seen in the type 1 hinge fracture, and this type 1 hinge fracture is called as motor cyclist fracture. Okay, so motor cyclist is a motor cyclist fracture. Abnormal skull motility, this is the motor cyclist fracture. Okay, and talking about this all, we come to the end of the fractures, types of fractures. Let's discuss the characteristic features of fractures. Anterior cranial fossa fracture, middle cranial fossa and posterior cranial fossa. Anterior cranial fossa fracture, we have CSF rhinorrhea. CSF will leak from the nose with CSF rhinorrhea, leaking of CSF through nostrils. So there will be dew drops. It looks like dew drops or halo. So it's called halo sign. Glucose will be increased, protein will be decreased because CSF will be there. Beta to transferrin is a specific marker for anterior cranial fossa fracture, and we will see the presence of black eye. Black eye will be there, black eye or raccoon eye. Okay, this black eye is a feature of ACF fracture. Okay, CSF rhinorrhea, halo sign, glucose increase, protein decrease, beta to transferrin and black eye. And middle cranial fossa fracture, there will be CSF otorrhea. Otorrhea means leaking from the ears. So CSF will leak from ear. We'll see battle sign. Battle sign is basically a black discoloration in mastoid region, behind ear pinna. Okay, this is battle sign. Ecchymosis in mastoid region. Facial nerve palsy. So facial nerve palsy will be there. Facial nerve will be injured, and hemotympanum. So you can see ear related things. Okay, battle sign, CSF otorrhea, hemotympanum, facial nerve palsy because it is associated with the middle ear, right? Hemotympanum is basically blood collection in the tympanic cavity. Posterior cranial fossa fracture, no such important thing, only a boggy swelling at the nape of the neck. Okay, come to end of the fractures. Let's move on to the Coop and country Coop injuries. So talking about Coop and country Coop injuries, basically Coop injury means injury at site of impact. Country Coop means injury opposite to side of impact. So whenever there is a wall and a person is hit here, so there is a Coop injury here in the frontal lobe, Coop injury, and there is a country Coop in the occipital lobe. So most common is the occipital Coop, and it's a mild injury. Country Coop, opposite to impact. Occipital lobe, no country Coop. Okay, there is no country Coop in occipital lobe. Most common is frontal lobe. And this is severe. This is mild, Coop is mild, country Coop is severe. So here we will be getting better understanding impact and injury. Impact means Coop injury is country Coop. Occipital impact, there will be frontal country Coop. Okay, frontal contricoup, this is the most common. Frontal impact, no occipital contricoup, because occipital lobe is smooth. The brain is not much trauma, there is no more trauma to the brain. Okay, so it is smooth. Temporal contricoup, there will be contralateral temporal lobe injury. Contralateral temporal lobe injury. So with this we come to the skull and thing. Okay, one thing is remaining, that is Pape's rule. Pape's rule states that new fracture line will never cross a previous fracture line. New fracture line will never cross a previous fracture line. Let me make you understand over here. Let us erase this first. Let me make you understand over here. Let's say a person suffers from a fracture on 25th June. This is the fracture line. A person suffers another fracture on 27th June and another fracture on 30th June, that is today. So this yellow line will never cross this blue line, because what I wrote, new fracture line will never cross previous one. It will never cross the 25th June line, and this 30th June line will never cross the 27th line. This 30th line will never cross the 25th line as well. Are you understanding? Yes. Okay. So this is the Pape's rule. This rule is called as the Pape's rule, and this Pape's rule is used for ranking the fractures. Okay. Let's move on to the next part.